Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. We are at episode 115 of the Codecast, and so we're excited to be here today. Hopefully, you are enjoying your holiday season and week and are looking forward to 2020. So this is the last Tuesday of the month, so that means, as you know, Top 10 Tuesday. Today, my top 10s are going to range from new 2020 CPT codes to some new Medicare information to look out for, and really what I'm calling my year of 2020 vision. I just want to really bring to you kind of a vision of seeing things more clearly, knowing the path and direction you want to be on, both professionally and personally. And I'll be embarking on some new paths and new projects as well. So I hope you join me in that vision, and we're going to get started by finishing off the month with some good information. Now, I want to apologize in advance. I'm hoping that you can't hear some of the background noise I'm dealing with. One of the things in my office building is that in the next building over, or I should say the next office over, I share a space with somebody who is in a band and he gives guitar lessons. And sometimes I can hear him through the walls. Now, I can hear him, but when I've done a replay back a couple of times, I haven't been able to hear it on the Codecast, so hopefully it won't bother you today and you can't hear it. But if you can, I'll talk to my producer and we'll try to get this out of there. Okay, so here's what we want to look at today. Also, before I get started, if you could do me a favor, when you listen to the Codecast podcast, if you could post a link to it on your social media platform, whether it be Facebook, hashtag Terry Tuesday, I actually have that trademarked, and also leave us a rating and review on Apple Podcasts or Stitcher, Google Play or YouTube, or wherever you listen to the Codecast. That really keeps us on the air with those good ratings, and I want to thank you in advance for that support. Okay, the Codecast today is also brought to you by the FIA Group, an experienced provider of healthcare cost containment techniques offering services designed to control healthcare costs and protect plan assets. FIAgroup.com. Also, Trident University International. Trident is a leading online university regionally accredited by WASC, serving members of the military, veterans, and their families. Trident.edu. Okay, so let's take a look at our top 10. So I've had some interesting things that I wanted to talk to you about. In talking about the year of vision, I know a lot of you are getting ready to take your coding exam. And so I wanted to give you some tips on that. And there's a few here that I think will be helpful. Actually, some of this came from the Added Edge, which is the Healthcare Business Monthly magazine for AAPC. And I just thought this would be helpful if you hadn't had a chance to really look at that. But one is leave electronics behind. So just leave your phones in your car. Don't bring them in with you. They won't allow you to have them anyway. So that's one thing that you can relax about. You'll be able to grab it again after you're done. Also, arrive early. Give yourself enough time for the exam, at least 30 minutes before the test starts. You have to sign in, get settled, use the restroom, make sure that you have allowed for traffic, etc. Believe in yourself. I know you've studied a long time and you just don't want to give up halfway through the exam because it's so overwhelming. But just take some deep breaths during the exam. Make sure you've given yourself that pep talk before you start. And remember, if you don't pass your coding exam on the first try, you get to retake it again for free from most companies. And so just don't beat yourself up if you fail. Stay positive. And just know this is something you really want because you studied so hard for it. So really just believe in yourself. One thing also, wear layers. Rooms are very weird on temperature control, and some may be hot, some may be cold, but they won't tolerate anybody being disruptive to talk about the temperature. So just make sure you wear layers. Bring plenty of number 2 pencils. Yes, we are old school when it comes to taking the test, and there's no time in between the test to sharpen pencils. There's not even a sharpener usually nearby. And make sure the pencils have good erasers, or bring a separate eraser. And you also may want to bring a highlighter as well. Take snacks and water. If you're hungry, you might have difficulty concentrating. And sometimes the snacks and water has to be outside the room. It just depends on what they allow as far as that proctor. Crunchy snacks and things like that can make it hard for others and other test takers to concentrate. And open your packages outside the room. So again, this is for outside the room. Make sure you know there's a proctor for most coding exams, so you need to follow their instructions. One of the biggest reasons that people fail their tests, or don't pass, I should say, is because they don't follow directions. And so following directions and instructions is really important. Otherwise, you won't use the answer sheet correctly, and you'll be really disappointed in yourself if you don't follow directions. Form a test-taking strategy at the beginning of the exam. So what is easier for you? Do you want to answer the compliance questions first, or do you want to skip a certain section and then skip around? But if you do skip around, make sure that you know where your bubbles on your answer sheet are. We've had somebody skip around before, and I've proctored so many exams, and all of a sudden they have one space missing, and everything was moved down, and you don't want to get off track on your answer sheet. Another thing is, a lot of people say don't clock watch. I absolutely do. Keep an eye on the time. You have 5 hours and 40 minutes for the CPC, for example. If you were taking the CCSP through a HEMA, you actually have all day, but you want to make sure you're finishing that exam. And it gives you just over 2 to 3 minutes per question. And some questions obviously will take less and some will take more time. But you want to keep on track and make sure you know how much time that you have. And there should be a clock in the room. So if there isn't, just make sure you wear a watch, but it can't be a smartwatch because, again, that can be tied to your phone and answers from a search. So that'll to make you take it off. And then don't get psyched out by the long questions. For longer questions such as op reports, make sure you highlight and underline the relevant information, and it just can help you focus on the information you need to answer the question correctly. And then when you look at the answers and think about how they relate to the question, I know sometimes it seems like they're trying to trick you, but use the process of elimination to remove any answer you know is wrong. So for example, if the question relates to an evaluation and management service code, but one of the answers is not an E&M code, then you can eliminate that choice. And they do that. And then document skipped questions. Clearly document it. If you need to skip a question, make sure you clearly mark any answer choice you already eliminated and jot down any notes you want to remember later. This way, 5 hours later, when you go back to answer the question, you won't have to remember what you were debating. So that's one of my top 10. I know that was a few tips on how to take an exam, but I just wanted to keep with the theme of the vision for the future. I know a lot of you are studying, and hopefully you'll find that helpful. Now, another thing that came to my attention recently, and it was actually by a colleague that I was talking to, because as you know, I have several podcasts that I host or talk on or, I guess present. It's hard to know what you call it. I guess this is a show, but one of them is PACOM, the Professional Association of Healthcare Office Managers. And one of the things that we were talking about is dealing with she calls it millennials. I talk about professionals, but basically the younger crowd who are in your office and they always have their cell phone. Well, the reason it came up is that I had an appointment to call her this morning. And when I called her twice, the phone was picked up and hung up on me. And I thought, okay. And I actually thought it was her cell phone when actually it wasn't somebody I've met before, was actually her office line. So I tried a third time. And after that, I was just going to email her, and it picked up and it had a practice name. And it was like, oh, wait, that's scary. This is a practice name. So I mentioned it to her. I said, hey, I've been trying to get a hold of you. This is my third call. The first two I was hung up on. And she says, I know, I have millennials at the front and they're learning how to answer the phone. And I said, excuse me? And she said, anybody that's between the age of 20 and 30 right now, they don't understand what it means to pick up a ringing phone. They just don't know how. She said, you have to not only train them, but you also have to train them on how to pick it up, how to push the button, how not to drop a call, and how to talk to people. And I think I was floored. I'm definitely old school when it comes to this, but it gave me that vision again to really just listen to what she had to say. And what I was thinking about with this is interesting because I see a lot of office managers in healthcare and in other different types of jobs saying that I will never allow my employee to have their cell phone. Well, she said she allows cell phones and iWatches for her employees because business has changed. She said there is a new way of communicating, which I have to agree, because when I get a call now on my cell, which is also my business line, it's interesting because it's usually my daughter, or I'll see a telemarketer, and now it tells you telemarketer. Or when somebody calls me, I'm like, what's wrong? Because we just don't call each other anymore. So unless I have a scheduled call, and I'm thinking, what's wrong with that? But a lot of people just do a quick text back. If they get a call or anything, it's just a quick text. We now text our physicians. She was telling me that she has a liaison between the hospital or between the radiology department or the surgery department, and she could give them a quick text and see if they're on their way or if they're available to talk to. She says with her employees, it's easier knowing that they've got their cell phone or their iWatch on their desk. If she's not happy with them about something, she said she just texts them a mean face emoji, and they'll either come into her office and ask her if she's having a bad day. She says, no, I'm not, but sit down, you're about to. And so she said it basically conveys her message easier than waiting for them to answer an email or to respond or to pick up the phone. And so she pretty much says she embraces it. And it was just an interesting concept and actually conversation, because they said, well, can it get out of control with how much everybody's on the phone, personally and on social media and always checking, Facebook or Instagram or things like that. And she says she does monitor. She says if it takes them a little bit longer than just a quick, text or whatever. But she said what was interesting is she had an employee that came into her office pretty upset and said, hey, my daughter actually, my young daughter fell out a window and I have to run home. I have something happening. She goes, how did you find out? She said, I just got a quick text from the sitter. And she said the sitter didn't want to call because then she'd have to be on hold and wait for somebody to find me. She said if she called my cell phone, I would have ignored it and then text her quick saying, why are you calling me at work? And so she said it was just easier to text her quick to say what happened, and then she could deal with it. And that makes sense. It's just, that's how we communicate nowadays. And whether it's right or wrong, it is what it is. So something just to kind of think about in 2020 is you're kind of getting clear vision. And 2020 vision, that is where you have perfect vision. Something to think about, because you just never know what somebody else is dealing with. And again, we are dealing with millennials. We're dealing with a younger crowd, and we're dealing with technology. Okay, so the number 3, believe it or not, is going to be some coding updates. And the first thing we want to look at is there's been a couple of coding revisions and updates. I'm not going to give you all of them, but I wanted to give you just a couple of the changes that I think are important. One is with modifiers. So revised guidelines now instruct coders not to use bilateral modifiers, the 50 modifier, I should say, with add-on codes. So they're saying that if it is a bilateral situation, report the add-on code twice using RT and LT to indicate the laterality. There are new codes in the evaluation and management section, new time-based codes, 99421 to 99423. They're created to report online digital E&M services. But make sure that these are patient-initiated. They have HIPAA-compliant platforms for the communication part. But make sure you know what your payer will consider as well, because not all of these online evaluations are covered. There are new codes for self-measured blood pressure by the patient, and they've been added to the digitally stored data services, remote physiological monitoring and subsection. And that starts with code 99473. Then we have some new guidelines for the surgery section, actually skin, and that is for the intermediate repair codes 12031 to 12057, and the complex repairs 13100 to 13160. They've been just revised to provide a clear description of what is required for undermining. So intermediate repairs include limited undermining, which what that is described as a distance less than the maximum width of the defect measured perpendicular to the closure line. So it's along at least one entire edge of the defect. So if you're dealing with any kind of suturing or debridements or wound closures, that's the area you really want to look at some of those new sets of guidelines. Then we have the musculoskeletal section, which is under surgery as well. We have a new codes created, 20560 and 20561. These are for needle insertions into a muscle without an injection. So these codes basically is more for kind of an exploratory look in that area. Then we move into cardiovascular, and the pericardiocentesis codes 33010 to 33015, they were deleted and replaced with new codes because those codes were basically descripting initial or subsequent service, and that's no longer based on that. So now we have one code, 33016, which includes image guidance when performed, and now three new pericardial drainage codes, 33017 and 018, one for 6 years and older, and then patients 5 years old and under, and then 33019, and that is with also CT guidance. Okay, so those are some new codes there. Then number 8 in our top 10, we have some new digestive codes for hemorrhoidectomies, 46945 and 46946. Actually, these were revised to include without image guidance. We have a T code section, category 3, code 0249T. That was deleted and replaced with a category 1 code 46948 for an internal hemorrhoid by transanal hemorrhoidal dearterialization, which is a less invasive procedure than a traditional hemorrhoidectomy. So if you are in general surgery or in gastro, something to take a look at. We have some new codes in the radiology section. And again, there are codes throughout the sections. These are the ones that I deal with primarily and that are also pretty generic. So we have a diagnostic imaging code 74022, and that has been revised to specify that 2 or more views are required for a complete acute abdominal series. Okay, and so that had a overhaul, as well as the GI tract subsection. And so they deleted 5 codes and created a couple of new codes for some PET scans. So make sure you take a look at that. And then we had a new code in the medicine section, a new influenza vaccine code, so for the flu. And that code is 90694. And this is a preservative-free vaccine that is administered intramuscularly. So more about CPT updates definitely can go on my website and find it on my blog. And we also have for purchase the 2020 new code books on my site. So if you want a PDF workbook on cardiology or GI or orthopedic, we have OB-GYN, we have some primary care offerings up there. Feel free to go to terryfletcher.net and you will see some workbooks on there. Okay, so let's get to our coding question for today. And this is something I might have mentioned recently, but I thought it was interesting. It came across this last week. It says, Terry, we were downcoded recently by Medicare on a 99213 to a 99212. And those of you that know what that is an E&M established patient visit. The physician spent 13 minutes with the patient, and based on their visit time, when I billed this for a pediatric patient, it was accepted as a 99213. Can you explain that time component and why the payers are different? Okay, so remember, CPT rounds up and Medicare does not. So with the 99212 being 10 minutes and 99213 being 15, for Medicare, you still have to meet those time thresholds before you can base your coding on that. So CPT rounds up, so 13 minutes is more than half, and you'd get to go to a 99213. Big conceptual difference for sure. And just remember your salutation for 50% or more spent counseling, and then total time of the visit has to be included. Now in 2021, we know things will change, as time will be a controlling factor the entire visit, and there'll be some time-based codes and extra time-based offerings as well. But until then, for 2020, we're still on the same rules for E&M services. So we just want to make sure that we are still following the rules until they do change in a year now. Our coding question was brought to you today by Medical Economics, Smarter Business, Better Patient Care, medicaleconomics.com, for the business of medicine, digital magazine, and health IT. Also, Movado Watches, one of the world's leading watchmakers, Movado, modern, ahead of its time, Movado.com. So my personal insight this week is kind of gross. It's about hygiene, and it's something I had heard on the way into the office on one of the news programs that I listened to. And okay, it's something I had to do some due diligence. I went to WebMD. I went to the Mayo Clinic site. I even queried a couple of the physicians before I wanted to bring this to your attention. But this was so gross, I had to bring it to your attention. And this is a medical platform, so you need to hear some of this. So it was posted that 1 in every 6 cell phones has fecal matter on it. I told you it would be gross. It was like, wait, what? Ew. Well, most people take their phones to the restroom with them and do their business, wipe up, and then pick up their phone and then wash their hands after, for those people that actually wash their hands. But it says that 18 times more bacteria than a public restroom is on your phone. So unfortunately, that's accurate. It's gross. But let's talk to our kids, talk to anybody in your office. Make sure that you post signs saying, please don't take cell phones to the restroom. Leave your phones outside the bathroom. Always wash your hands, and make sure that you tell people in your office. I only see you have to wash your hands before you leave the restroom in restaurants. That should be in every healthcare office. It should be something that is on your meetings that you have in your practice. Practice meetings aren't just about billing. They should also be about patient safety and employee safety as well. And this is one of those things. Also, there's something out there, and this is why it even came up. It was an advertisement for something called phone soap. You can check it out on phonesoap.com. So because germs and bacteria grow and thrive on our phones, remember they're always warm, because a lot of people don't even turn off their phones for a break, and they're stored in dark places. And so that's where the bacteria can grow. So if what phone soap is, it's the first and only cell phone charger that sanitizes and disinfects the phone using ultraviolet rays while it charges. It isn't water-based. And so you can find it on Amazon. You can go to phonesoap.com, but it's been proven it's effective, and that's where we're at in this day and age, folks. So I just want to let you know, here we are. But it is something you have to deal with. I mean, I'm sure you've seen the commercials for it. So just something to keep in mind if you're wondering why maybe something keeps getting passed around at your house, or why there's, sickness that you can't seem to get rid of. That could be part of it. A lot of people want to automatically blame it on mold in their house, but think about cell phones and electronic devices, and everything's a touch screen. What you touch absorbs into your device. And if you aren't washing hands and desanitizing daily, it's getting on everything. So, and do your kids, do you know what they touch at school? Then they put their phone, put it back in their backpack. It touches everything. It's making me sick just thinking about it. So just keep that in mind, something to really embrace, and hopefully you'll figure out what to do about that. So everyone, hope you have an amazing holiday week and the rest of your happy new year. And that's a wrap for me on this Terry Tuesday. Make it a great day, a great week. And thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1, or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.